Hey Dale, I heard you got your BrainScan report. How'd it go?
Yeah, the BrainScan report is something that I've been looking forward to. And of course, a little concerned. I want to make sure that mine's okay. But I think it's something that's so important because it's changing the way we're able to keep great cognition for our whole lives. And so here's my report. I got my blood drawn a few weeks ago, and it's got three factors in it. So this is now, for the first time, you're able to look into your blood instead of having to do a PET scan or a spinal tap or something like that. So the first one here is p-tau 217, and that is a really important number to know. We should all have one because when tau is doing its normal job, so it's sitting here and things are doing well, the tau is like bolts on your microtubules. So it's literally supporting your structures in your neurons to make connections. The same protein, now when you've got an insult, when you've got problems with in a bacterium, a virus, a mycotoxin, any of these sorts of things, there's a signal sent that phosphorylates the tau. It pops it off the microtubule, and now it changes from a stabilizing structure like a bolt. Now it changes into a prion, which now goes and is actually actively seeking out to kill microbes. So now it's an antimicrobial protein. And so you want to know if there's a lot of that going on, you are going toward what would ultimately be Alzheimer's disease. So we all want to know that. And so here I've got my own result here. My result was 0.28 nanograms per liter. The normal is up to 0.47. You really like to be less than 0.34 if possible. And mine was at 0.28. So I'm very glad to see that. That means that I'm not headed, I don't have anything going on in my brain that looks like it's headed for Alzheimer's disease. Now, I'll repeat this. Usually what I recommend is repeat it every 5 years. But if you're over 60, and I'm way over 60, I will repeat it in 2 years. You also, of course, want to repeat it if you have any cognitive problems. So if I have some issues over the next couple of years, I will repeat this. Otherwise, I'll wait a couple of years and do it then. Now, we want to get other information as well. So the second thing I'm going to look at here is NFL. So this is neurofilament light. So these are filaments in your brain cells, in your neurons. And if you've got damage to these neurons for any reason, it can be from frontotemporal dementia, it can be from vascular disease, it can be from even ALS, the NFL goes up, can be from traumatic brain injury, that sort of thing. Any of those, this is then going to go up. And so here, these are, as you might imagine, going to be age dependent. As we get a little older, the NFL does tend to go up a little bit. Now, mine was 16.57. The normal is up to 37.9. So I'm very happy. That means I don't have ongoing damage to my neurons. And again, I will check this again in a couple of years, or if I develop symptoms. So happy to see the NFL result. Now, the third piece, which is complementary to those other two, is GFAP. And GFAP, instead of coming from the neurons, it's coming from the support cells around the neurons, the astrocytes. These astrocytes, it's like the caretakers, basically. They are supporting the neurons. And so when these things get activated, and they get activated because of inflammation, or they get activated because they're attempting repair, then these things basically hypertrophy. They get bigger and they start making more of this GFAP, which is an intermediate filament protein, which is there for structure. So when these things really get active, the GFAP goes up, and that tells you there's some ongoing inflammation and or attempted repair. So mine here was 58.4. Normal is up to 78.2. So normal, I'm happy to see that. So I have a normal p-tau 217, which tells me Alzheimer's is not in my near future. I'm happy about that. I have a normal neurofilament light, which means that my neurons are not under attack. They're not being damaged. And I have a normal GFAP, which says that there's not any ongoing inflammation or ongoing attempted repair. So very happy about that. And as I said, I'll repeat this in a couple of years. And again, this is something that's going to change the way we think about these diseases. And it'll allow all of us, just as years ago, people started looking at insulin resistance instead of waiting for people to get full-on type 2 diabetes, really changed things, made it so much easier. We can now see things coming and we can get active ahead of time and make sure that very, very few people ever develop dementia.